If the patient is admitted with the complaints of chest pain and MI is suspected in the patient, then the immediate management started is to provide the oxygen to the patient with the rate of 4 to 6 liter infusion. Then sublingual glycerol trinitrate is given to the patient. Then IV morphine to relieve the pain in the patient is given. It is 3 to 5 mg and it is repeated in 5 to 10 minutes after the first dose. Then the aspirin is given to be chewed by the patient, and also the clopidogrel is given orally, that is 300 to 600 mg. Then once the diagnosis is confirmed by the investigations like ECG, troponin I or T and CKMB markers are present, then the specific therapy can be given to the patient. Those include the PCI or thrombolysis. Then beta blockers can be for like metoprolol can be given to the patient unless it is contraindicated. Beta blockers are mostly contraindicated with the patient in the patients with the history of bronchial asthma, or any like AV block is present. So in those patients, beta blocker is contraindicated. Then treat the complications of the patient along with the MI, like arrhythmia, congestive failure, or shock is present. So in this way, the MI patient is approached. And the thrombolytic therapy which is given is initiated in within the 30 minutes of the patient came to the hospital. In this, the streptokinase, urokinase, reteplase or tenecteplase like drugs are given. In thrombolytic therapy, if is not given in the patient in which it is contraindicated, for example, patient having the history of any active bleeding, history of hemorrhagic stroke is there, if any poorly controlled severe hypertension is there, any GI bleed or major surgery or pregnancy, it is contraindicated in that patient. So and the PCI is carried out through the angioplasty or stent placement in the coronary artery. In the coronary artery is done in the patient with MI.